Goldy's Closet. We are back with part 2. We're blessed to have Dr. Madison back in the house to talk more just about overall oral care, gum, not gum safety, but just, I don't know, gum goodness. I found Dr. Madison online on Instagram and was just so moved and taken by all of his content. He's got a great attitude. He's a fun guy, but he's really, really, really educated and brilliant. And it's so nice just to have somebody transparently sharing information that they've learned. He's always continuing his education, and he's shared the first tip about the 3 surfaces that we have to clean with our oral care. We got that on 189 podcast. Go back and check it out. We've got the second thing that we were talking about, which is just how gum disease, had no idea, can overall affect your wellness on, I didn't even know, aging. Really, Dr. Madison?
Yeah.
Really?
Well, inflammation, drives aging. In fact, a lot of chronic diseases like diabetes, cancer, Parkinson's, Alzheimer's, all of these things are thought to be driven by inflammation. So anything we can do to reduce that in the body is helpful for our longevity and quality of life. You can be old but have all of these chronic diseases. You can be older and not have any of these diseases. So and knowing this information, armed with this type of information, there's a lot that we can do at this age so that we, age a little bit more gracefully.
Aging gracefully is so important, especially for everybody in, the business that I'm in, and a lot of influencers and everything. And I think that sometimes gets a bad rap. Like, some people either love everything that I'm talking about, but I am just we talked about Garo Kasabian in the first podcast that we did, 189. I say if it's available and it's relatively safe to do, and it makes you feel better about yourself, that's a hell yeah from me to go do it. And I love talking about procedures that I've had done. And I love talking about the Botox that I get or filler or whatever. And you can be a fan or you can not be a fan, but I like to be transparent with people listening and that follow me on, this is what I'm doing. And I hope it's safe. I think a lot of the people that I do. So if you don't like it, we can do another podcast about that. But my point is transparency. I like to talk about things that I do. And I'm a big, just overall health and wellness person, with supplementation, with eating proper foods and raw foods and whole foods and diet, and just getting enough sleep. And exercise is my biggest passion, doctor, just because I think it helps with so many things, especially with anxiety and depression and the endorphins that it just forces into your system. And I always call bill collectors or somebody that I owe money after a really great workout, because there's nothing you can say to me because I'm in a good mood. And just overall prevention is so important, and not just with your gums and with oral care, but just everything across the board. I think you're preaching and teaching with all of your videos. Follow him. Look at the ticker on the bottom. You're preaching so many little tips and tricks that, I didn't know, and you get over and you look at a store, you look at like the charcoal section, what's the rage of the charcoal? Is that really cool? Or tell us a little bit about that, because everybody's
charcoal kind of came into being as a fad. Some people, charcoal has been used traditionally as they were using ash, basically charcoal ash, like in hundreds of years ago when they didn't have toothpaste to brush their teeth with. And somebody thought, well, if they were using it back then, it must have been holistic and good and blah, blah, blah. So they started incorporating it into toothpaste, and it became a fad, and people think that it whitens their teeth, or because it's charcoal, it's neutralizing something in their mouth. But one of the things that we need to remember is toothpaste have an abrasive in there intentionally, because that's what cleans the teeth, cleans the stains and also cleans the plaque of your teeth. And there can be different grades of abrasive, kind of like sandpaper. So you can have a very fine grit sandpaper, and you can have a large grit sandpaper. Mm-hmm. And charcoal is that large grit sandpaper. So yes, it does remove your stains, but it also is removing your enamel. And if you remove enough enamel, you can't get it back. The only way you're going to get it back is if you get a bonding on it or a veneer. And why would you want to do that to yourself? So it just makes no sense from a health perspective to be using that. again, on a daily basis. Like, if you use it once in a blue moon, I'm okay with that. But it's not something you want. That shouldn't be your toothpaste you're using on a daily basis. And that's why I don't like charcoal. Another issue I see is a lot of patients actually react to charcoal, and the inner lining of their mouth starts to peel away.
Oh
So
God.
yeah, it's almost like an allergic reaction. So they come in, their mouth is on fire, and they're like, I don't know what happened. Everything was normal. And the first thing I ask is, have you changed your toothpaste? And 9 out of 10 times they're like, oh yeah, I started using, this whitening toothpaste. I started using this charcoal toothpaste. And as soon as we switch them out to something, that doesn't have any of that stuff, it goes away. The issue goes away. So, again, in general, not a fan because it just has too many problems.
How does gum disease, how is it connected to halitosis? Isn't there two
Yes.
different ways that you have bad breath? It's either like initially orally here or in your gut. Like, can we just talk
Right.
a little bit about that? Just because we're going to fill up one more pod and we can dip in and then we'll hit the last point that we were going to hit with dental implants. Let's talk a little bit about that.
It's a great point actually. So most halitosis or bad breath originates in the oral cavity. So like if you were going to divide it, like 90% of the time, it's because of local issues in the mouth, and the 10% is issues either with your gut or your sinuses.
I've never heard that.
Right. So, and the big driver of halitosis is gum disease or inflammation of the gums. So if you have gingivitis or if you have periodontitis, basically you have a chronic infection that's sitting there, that's festering every single day, that's not being cleaned or treated. And it has its odor that, it's associated with something that's rotting and it's disgusting. So, if you have that rotten egg smell in your mouth, it's from halitosis. So, most of these bacteria are in between the gums and the teeth. And one of the hacks that I showed on TikTok that, people really enjoyed is if you get a piece of floss and you floss in between your teeth and you smell it and it has a rotten smell, you probably have gum disease that's causing the halitosis in your mouth. The other test is to lick your wrist and smell it. And if that doesn't smell so good, you probably have a lot of these bad bacteria. Yeah, let's do that. But you gotta wait. You gotta give it, wait 5 seconds, then smell it.
I'm going to wave it around.
Yeah. Right.
I mean, it's not like perfume. It's not heinous. Like, do I have
So
gum
you're
disease?
okay. Yeah. I mean, saliva has an odor, but
Yeah.
if it smells like rotten eggs, yeah, that's the smell we don't want to have.
But I mean, mine doesn't smell great. I'm just,
Yeah.
I mean, it's not like I was just chewing gum or something like that, but it doesn't smell like rotten eggs. So I'm okay, right?
You're okay.
Okay.
So the question is, how do you get rid of this issue? So first thing is, don't use any mouthwash that has alcohol in it, because alcohol dries the mouth even more. And the last thing you want is a dry mouth, because dry mouth also doesn't, if you don't have enough saliva, you're not washing away these bad bacteria. So you want to do whatever you can to increase, your salivary flow. And alcohol is not a good option for that. So don't use Listerine and things like that because that's not going to solve your mouth, the halitosis issue. So it's important to, brush really, really well. It's very important to floss and to use a tongue scraper.
Oh, let's talk about the tongue scraper.
Right.
Somebody years ago, nobody knows about the tongue scraper.
Right.
Nobody knows about this.
No,
have you done a video about the tongue scraper yet?
I haven't done a good one, but it's in the works. So there's different types of tongue scrapers that you can use, but they basically all do the same thing. They basically remove this overgrowth of the white stuff on the surface of the tongue. So you just want to do it nightly. I'll be honest with you, the first probably week that you're going to do it, you're going to gag because nobody likes to shove things down their throat, but you do get used to it after a while. So if you have halitosis, tongue scraping is important. If you don't have halitosis, you don't have to tongue scrape every night. You can do it like maybe once a week or a couple of times a week. But if you do those three things, so brush really well, floss well, and tongue scrape, you're going to eliminate majority of your issues. If those don't help, then there is some specific mouthwashes that are for people that have halitosis. There's one brand called Closest. There's another one called Smart Mouth. These two have zinc in them, and zinc is known to eliminate the bacteria that cause halitosis. So,
But leave the good bacteria in there?
they're more selective. I mean, they're not like 100% selective, but they're more selective. But listen, if you have halitosis, that's a major social, issue. So you want to get rid of that. But and once you get rid of it, you don't need to stay on it forever. It's not something you
Okay.
need to do. Yeah.
No, what about now? I remember this as a kid. Don't gross out on me, everybody, but I'm probably just saying what other people are thinking. I remember coughing and having this like really weird little granule of stinky crap.
Right.
Like what
Right.
it wasn't a lot of it, was like one.
Yeah.
And then I remember
Yeah,
like,
yeah.
what is this? And it always
Right.
looks like some weird
Yeah.
alien rock. And then
Right.
what is that called?
So it's called a tonsillar stone. So the tonsils sit in the back of the throat,
Okay.
and they have little crypts or caverns in them.
Yeah.
And some people, not everybody, forms these what we call stones. It's basically like calcification of bacteria that's in there.
Yeah.
And yeah, it smells really rotten. So if you get tonsillar stones, you can have halitosis because of that. There's no easy fix. If you can, some people can kind of like pop them out with a Q-tip. Some people can cough them out. Some people use water pick. But if it's something that's very chronic and happens all the time, then having a tonsillectomy is probably the only way to treat that.
I was gonna say, like, I mean, mine are like once every year or two. I'll cough one out. Like,
Right.
what did I do to get those?
It's just the way it's predisposition, just the way you're built.
The way I'm built, I
So,
get these
yeah.
rock stones.
Yeah. Don't you wish there were diamonds? That'd be better. Once
Yeah,
you get a
right. No,
diamond. Yeah.
I'm just so fascinated by what your body produces. It's just so flippin' fascinating. Like, just all
Yeah.
my friends that are doctors and other surgeons and whatnot. It's just absolutely fascinating. Just everything. I could just it blows me away. Like, just how many years of education did you have to have initially to open your practice?
So it was 4 years of undergraduate, 4 years of dental school, and career training is 3 years.
Wow.
That's
So
a lot of
11,
years.
11 years.
Yeah.
And then you're consistently, like, every year, every 6 months, continual education. Like,
All the time. I mean, I'm a nerd all the time. Like I
Wow.
read a book cover to cover on Saturday. So yeah.
really? Let's talk about dental implants, what you do, dental implants,
Yes.
how they work, what they replace, who's a candidate for them. I'll tell everybody why I'm such a huge advocate for, well, I'm not a big drinker and everybody knows that. So I'm always telling everybody to chill out on the drinks, that there's other things to be drinking sometimes. Not that we'd all can't kick back and have a nice glass of wine or beer, or whatever people are doing, but I always tell everybody just to use it in moderation, because a lot of the people in my world aren't using it in moderation, and then they spend their entire existence trying to just wake up at here, and not here, just trying to get up to here. So I'm always a big advocate on moderation with that. But I do understand people like their stuff. But I was hit by a drunk driver when I was very, very young and smashed my face. And so a lot of people don't realize that, these bottom guys down here are dental implants. And I had them done when, things weren't as advanced as they are now. And it was painful as hell. And they're grafting skin from the top of your mouth, where that was really painful for a little kid. And, you're growing and things get weird down there sometimes, or they got infected when I first had them done, and they were scary, and they're not scary anymore. Like, we've moved, because it was a few years ago, wink, wink, that I was 8, 9 years old. Things are a lot different. Like you said, from when you learned how to do sutures, from when you learned different, how to do what you do in school and residency, to now, things have changed a lot. Are implants just something that's like more the norm now? They're not as scary. Let's just talk about implants and who's a candidate for them and why they're a good idea.
So, I mean, implants have come a long, long way the last 10, 15 years.
I can imagine.
They've been around for about almost 45 years now. So, I mean, they've been around for a long, long time, but the technology of the implant itself and the way we, put the implants in has really dramatically improved, which is a good thing for everybody. So who's a candidate? Basically, if you lose a tooth for whatever reason, it could be trauma in a car accident, it can be that you chewed on something and you broke it, could be gum disease, but whatever the reason is, you lose the tooth. At this point, the best option to replace that tooth is with a dental implant, and I'll talk about it why.
Yeah.
So an implant is basically like a little prosthetic screw that's about 1 centimeter, so it's about that big, that goes below the gum line in the jawbone. So it's like a little screw that goes down in there and grabs the bone, and that acts as the foundation to the tooth, or the crown that we build, that gets secured on top of the implant. So, so basically, if you're in general good health, if you don't have any active, serious diseases, most people are candidates for this. And the way it's done is typically takes about, 1 appointment to put the implant in. Then we usually wait about 3 months and monitor the patient to make sure that the implant and the bone set together. And then a tooth is made, custom made, that goes over the implant, and it fits securely over the implant and stays there generally for a lifetime.
But wait, you said you first want to make sure that you drill the hole, you put the metal. It's still metal. Is it still metal post?
It's a titanium, which is a type of metal, and now there's also ceramic options. So it's basically zirconia implants too.
But then what goes over that while we're waiting for that to take, so to speak?
So when it goes down, it's flush with the gum line generally, so you don't see anything like sticking out. So you can have some sort of a temporary retainer or something that goes over it, so you're not missing a tooth. In some cases now, we can actually put a temporary tooth on the implant. So you walk out, you come in, we take the tooth out, we put the implant in, and a temporary tooth all at the same time. So you walk out with a fake tooth that's in there. Yes.
How when you drill down into the bone, is it with like a bit with threads, or is it just a hole that is a tiny bit smaller than the screw is going to be, like you would a regular wood screw, or you know what I'm saying? Like,
right. I mean, you really want to get into this gory detail, I see.
Right. Fascinating. Who else am I going to ask my plumber down the street what's cooking?
This is amazing questions, actually. So no, we use drills that are, obviously specifically made for this purpose. Right. And then you start with a very small size drill initially, and then very slowly you enlarge that. So you go from one drill that's like, let's say 2 millimeters to another one that's like 3.5 millimeters, and slowly enlarge it. You don't want to go to the largest drill. It's not like drywall where you can just basically go to the final drill, because bone actually is very sensitive to heat. So if you're not drilling the right way, you can overheat the bone and cause issues. So you go to the final size. Usually use anywhere from 1 to 3 drill bits to go to the final size. And that final size is a little bit smaller than the size of the implant. So as the implant goes in, it kind of grabs the bone.
Okay, that makes sense. When you drill, is this a human drill? Or is there like an apparatus that goes into the mouth, like a drill press, so that you get a nice clean, angle?
Yeah. So the angulation used to be all what we used to call brain guided. So you basically had to have enough experience to, drill it in the right spot. So it's basically what we call a handpiece. So it's like a little drill that's like a pen that has a little extension coming this way, and you use that. So I would say still majority of the time, things are just, we visually place things. But nowadays, with the advent of digital planning and digital, CT scans and things like that, about half of the time now I place my implants using digital guides. So it puts it exactly where it needs to go. Everything's pre-planned. So it just has become much, much more, precise.
Okay.
As far as the patient experience, I like to sedate majority of my patients because it's a win-win for everybody.
Oh,
they don't
God,
have to go
who would not want to be sedated for this?
Yeah, exactly.
Are people not wanting to be sedated?
Well, I think if the patients have the choice, almost all of them want to be sedated. But I think some dentists don't have the proper licensing to sedate patients. So, that's where...
So what?
Yeah.
You're just numb or what? Like,
Yeah. Yeah. I mean, you're
oh
very numb
God.
anyway. Even when we sedate, we numb the patient. You can't ever do something without the patient being numb. So yeah, the patient experiences, they don't, usually they don't have a recollection of it, and it's minimal pain afterwards.
Yep.
Because if you do it the right way, there shouldn't really be any, excessive pain. Most patients can manage their pain by taking Advil or Tylenol. We never prescribe any type of opiates or, OxyContin or anything like that. It's just ridiculous to use for this purpose. Yes.
Why would I go to you? Why are you the guy? Is it because, like, why?
I mean, look,
I
there's
wanna
there's
hear
a lot
why.
of, honestly, there's a lot of very good periodontists. There's a lot of qualified guys out there,
I'm not
but
asking that. I'm asking why
yeah,
people go to you.
why me? Because I'm very passionate about what I do. I'm continuously improving my skills. I'm just a gentle soul anyway. I can't see hurting people, so my shots are very easy. My patients don't even feel me giving the shots. My patients have no pain afterwards because I use extremely gentle techniques in the way I make my incisions, the way I suture, the way I place the implant. So 90% of the patients, take Advil just the night of, and they don't need anything the next day. Even if I'm doing some, extreme makeover and, complicated bone grafting and things like that. I'm not saying that's 100% of the time, but I would say 95% of the patients are in that category. And I'm honest, I've been doing this long enough where my reputation is all I got, and I'm not gonna, I'm not out there to try to make a killing on one patient. I understand that there's enough business for everybody to go around, and that's how I've grown my practice. That's how I've become successful, and that's what I preach to my students, to people that I teach. In fact, my son's in dental school. He's going to follow in my footsteps. Yeah,
Oh,
I know it's like the. So that's just the kind of guy I am. I just want to be honest and upfront, and like you said, raw. I don't want to BS anybody. Even on my Instagrams, if I don't like something, I go hell no and I throw it, because there's no times. Life's short. You don't want to have. We don't have time for bullshit.
yeah. No, I can just tell you're so lovely to even speak to and correspond to, and that I've been doing entertainment and life for so long, and I started when I was so young in this business, and you just start to be able to read people and be a good judge of character, and there's a lot of phony balonies out there, and I could just tell. I say gentle pup. I'm always calling people a gentle pup. They're a gentle pup. Like, you just want to be around. You want to be around good people, and especially with something as terrifying for so many as the dentist,
Yes.
let
Yeah.
alone your level of dentistry. I don't want to know. God, please sedate me. I don't want to be going to something thinking that I'm going to be tossed around. Or you've seen horror stories of people, and
Yeah.
there's even some surgeons in your town that, man, some of the stuff that I hear about some of the plastic surgeons, like what they're doing, behind closed doors, or this, it's just awful, awful things. And you just wonder, like, douchebag, like, what's your deal? Like, what makes you think that you can do that? Or I guess a lot of doctors do play God or think that they're above certain standards, or like a lot of the Hollywood elite that I was around when I lived there. They just
I think when you're surrounded by people that just keep praising you, it can, if you allow it, it can get to your head, and then
yeah,
I think you can walk on water. But
that's anybody.
You got to stay humble.
That's in any business. That's in any business.
Yeah.
Let's talk really quickly about just directing more business to you. You're in the Beverly Hills area. Like,
Yes.
where I didn't look exactly where you are. Where are you? Who are you by? I'm trying to picture you.
So I'm on South Beverly Drive.
Okay.
I don't know if you know where Earth Cafe is, kind of like catty
Oh
corner to
God.
Earth. Yeah.
It's still there, doing well?
Yeah. Oh, it's
Oh,
gangbusters.
please let me meet you at Earth sometime when I'm in town.
I would love that.
That
Yeah,
was one of my
course.
favorite places. And then even Tender
Yeah.
Greens. I know it's a chain, but I love that.
Yeah.
And there was one place on Little Santa Monica. I think it was Beverly. Oh shit! I just knocked my. Excuse my language. It was on Little Beverly and Santa Monica, and it was like an Airstream trailer.
Yes. Yeah.
Is
They
that
closed
gone?
that one. Yeah, it's gone.
No,
Yeah.
I love that place. That was really, really cool. Lot of good jams. Let's close on just your business. And again, you gave us, I asked you to give your sell
Yeah.
on why you're different, but tell a few more people why they need to come see you that's out there. Cause I want to include this in the
Yeah.
article.
I think, I mean, I really look at each patient as an individual, and again, those of us that are in healthcare are a little bit more enlightened. We realize that healthcare needs to be individualized. Every person has a different genetics, they have different microbiome, they have different everything, different needs, different backgrounds. So you can't have one approach that fits everybody. So I really look at the patient as a whole, where their mental state is, where there's oral health, how's their whole, overall health, and tailor make the treatment for them. My office is very organized. I have amazing team players. Everybody's on the same page as far as we're all there to help the patient. Every single person of people on my staff is the same, of the same character. We go above and beyond to make sure the patient's comfortable. Like they get blankets, they get pillows. We cover, just little things that make a big difference. I see a lot of patients who have been previously traumatized by other dentists. So they come in, white knuckled, and they're crying. And again, we have a way of calming them down and having them go through the treatment, because it's a travesty if somebody has a need, but they're not doing it because they're scared. And I understand that. I mean, 90% of patients at some point in their life, they've had some sort of trauma with the dentist and they never want to go back. And I don't look down on it. I don't judge them for it. I realize this is what it is, and we get around it. So I think that's why I think overall the office is just geared towards the patient. It's not, for my well-being. It's not for anybody else. We're just like, obviously we're trying to make a living, but we don't let insurance dictate what we should do, shouldn't do. We're just there for the patients, and we try to provide the best and the most optimum care that we can. So I think that's what sets us apart.
No, I think that's a beautiful, beautiful answer, and I really appreciate that. I want to include it in the article. Like I said, this has been Goldy's Closet. This is 190. This is part 2 from 189, Dr. Madison. And the name of your company is Beverly Hills Periodontal Institute?
Correct.
Okay. I didn't know if that was a subsidiary of some other Dr. Madison, but you have a beautiful website. Just everything about you is beautiful. A gentle pup. I just thank you so much for educating us on some really interesting things that this just isn't something that people are talking about every day. And that's why I love your page, is because it's things that we should know about that you just aren't talking about. Gum health. That's just not what on the street. It's not the word on the street every day. So very important. I had no idea from the 2 podcasts that you were so gracious enough to give your time to, that it really does affect overall health and aging and many different things. I really, that's the biggest take home for me. Like, I didn't realize that. And just all of the things that you taught us about taking care of ourselves, everybody listening, you've got to apply the lessons that you've learned to like everything, to whether it's, cleaning your nails or other things on yourself that you need to be tending to. Just, guys, just you need to just practice a little bit better hygiene. I see some of your posts and what's cooking you can tell by somebody's posts, Dr. Madison, like what's going on in their life, all the crap in the background. And when you're posting pictures of yourself in the mirror and all the selfies that you guys do, and I can see like all the crap that you're using and the junk and the dirt, and like, you just need to just take better overall care of yourself. And I will just end on that note, whether it be your gums or wherever. So Dr. Madison, thank you for educating a lot of dudes, a lot of guys tuning in. We love you. We appreciate you. But you know what, dudes, I want you smelling good, and I want you on your best game. That's why we did this podcast for you, so that you're putting new nuggets into your head and you're thinking of ways so that you smell better. Because you smell better, you're going to attract more babes in between whatever you're into. I don't care. We just want to keep you happy, and we want people. I want more of those tweets that I get about I found a wife, or I found a new partner, and it was because of tips and tricks like on this podcast and me just yelling at dudes. That's what I do. So any last closing thoughts before I let you go? I'm so grateful for your time. Any closing thoughts?
No, this was a lot of fun. I loved it. Thank you so much for inviting me.
As always, we want to thank everybody for humbly allowing my little show every week. Goldy's Closet with Dr. Madison. Follow, check out the ticker clicker on the bottom. We invite you to be free, stay safe as always, and stay golden. And we clap one last time. Yay.
Thank you.
What is up, my golden peeps? Don't forget to join us for last week's episode 1. And thanks for listening. Hey, stay golden.
What's up, everyone? It's Goldy, Impact Wrestling, TLC's Cheapskates. Ted Nugent's running wild from him somewhere in the woods. And maybe you've seen our band, Goldilocks Band. We're out there, we're on tour, but now we're connecting on Cameo. So I want to tell you that I am here to be your humble servant, and that's whatever you need said for you, for a friend, a shout out, a golden shout out, you name it, here and on it. Now, just reminding you, keep it classy, keep it cool, and keep it above the belt. But I want to offer you something a little bit different. Just remember, if I'm not on the road and I've got access to these next beauties, we can always have Da-da-da-dum. I want to make this the most amazing experience for you ever, because you deserve it, your friends deserve it, your loved ones deserve it. And just remember, I can sing you a few lines of a song. It can be from anywhere, like it can be from Somewhere Over the Rainbow, or it could be near, far, wherever you are. It could even be on a highway to hell. It can even be from there. Oh, and keep in mind, not all requests are the same. Maybe your motivation comes with a harder edge. Maybe you need a more jagged little pill. There's nothing that I love more than playing the heel. So if you need your message delivered with more, what's the word I'm looking for? Intention? Please specify. Can't wait to connect with you on Cameo. Thanks so much for being here. Stay golden.